Thank you both so much for agreeing to be on the panel. I think that we're sitting in a really good place to have a conversation around race, equity, and inclusion and what it looks like in our work. And I actually want to ask Patrick this first question. When we think about Ferguson to Baltimore and the many places in between and in the past year, the things that have happened there and the long road we have to travel to have an equitable society, despite what feels like an enormous challenge in front of us, what gives you hope that we can make progress towards equity and inclusion?
So I thought a lot about this question because it's been, in some ways, an incredibly discouraging and painful time over the last year. As people know, we're headquartered in Baltimore. The last 6 months have been a time of a lot of soul searching and reflection, I think, for everybody personally as well as for the city and I think for the country. And so there are times when it feels that there isn't a lot of sense of hope. And yet it really is that very taking up of painful reflection that I think needs to give us a sense of hope. These are not new issues. These are not issues that emerged 6 months ago, a year ago, 10 years ago. We're talking about decades and decades of failing to take up these issues. So one thing that gives me a sense of hope is that it feels that this is a moment in time where, after kind of a long pause in the national conversation about race, it is being reopened, and in a deeper way, at least than my memory, than it has been since the 60s. The other piece that gives me hope is really kind of a big macro trend. The demographics of the country are changing, and they're changing rapidly. And because of that, just from the standpoint of the survival of the country, our economic survival, it is becoming increasingly impossible to just say, well, there are certain people who will just be left behind and left on the side that we don't have to worry about, and we can blame them, et cetera, and feel good about ourselves because we're, somehow better than they are. The demographics just it won't work. It won't work. So we're coming to a crisis. It's a slow-moving crisis in some ways, but we're coming to a crisis in terms of the people we're leaving behind. In that context, on a more personal level, I get a sense of hope from, I have 4 young adult children, and get an opportunity to see not only them, but the people that they are friendly with and that they hang out with. And it's just a wonderful generation of people. And their willingness, ability to not only talk about race, but actually live their lives differently certainly is a huge sense of hope. So I think I'll stop there. Those are kind of the things that I thought about when I had that
Joyce,
question.
you've actually we heard of all the work that you've been doing, so you have been hopeful for quite some time and actually been able to take a public child welfare system to action. And can you talk a little bit, where we're at as an initiative is we're in the hopeful stage and trying different things. Can you talk a little bit about when you first started, what gave you hope and allowed you to move forward?
Seeing the experiences of foster youth at every level of a child welfare system, from being a direct practice caseworker to supervising and managing cases, to being a regional and program director, and then being responsible for their outcomes at a state level, and seeing the well-meaning and well-intentioned people all along the way who have strong desire to change outcomes. That gives me hope. It gives me hope to know that we come to our work to help and not to hurt. But in spite of that, I also see that for 35 years, I would say, that we've been lifting up a lot of the same problems. And I do see that the times and what we see happening in the country today is opening the door for us to have the real bold and courageous conversations that we have not had over the years to really help us to get to what I call the cause of the cause. Why is it that in spite of our good intentions and all of the programs and services that we put in place, that we have not seen the results that we all so much desire to have? And so part of what happened in my work in Texas was that from my very first job as a institutional worker at the time, my first job was to place and or monitor the placements of youth in residential treatment facilities and state schools. We used a lot of state school placements back then. And I have carried with me on my journey in this work the faces of the children who made up my first caseload. I still remember making decisions for them that I never would have made for my own children. Yet I didn't have the space, nor the language, nor the okay or the information that I felt like I needed to raise issues, because my caseload back then was made up primarily of older African American teenagers. That is still what we see today in terms of the disproportionate representation of those youth in residential and other congregate care. And so as a leader, what gave me hope was that maybe I could have some impact. Maybe I could change the way that now caseworkers under my supervision, maybe I could create the space for them to ask questions and raise issues that I didn't know how to raise and didn't have the space to raise. And so it was data, really, that really was an opening of this serious conversation that we needed to have. Data disaggregated by race and ethnicity that told us that we really needed to go beyond the surface in our conversations. And so I started at the regional level examining that, and in examining by turning the mirror inward, not looking out and asking what's wrong with children, youth, and families, but asking what happened to them. And once we changed the way we asked the question, then we really began to see some of our responses change. And me telling my story of my personal journey towards leading work at the state level is a whole day's workshop. So I'm gonna fast forward and just tell you that when we created that liberated space to talk about institutional and structural racism in our work in the child welfare system in Texas, when we could understand not who was a racist, but what racism had done to all of us, then we could begin to examine the lens through which we viewed certain populations and how that shaped our decisions. And it began to create a cultural and philosophical shift in the way we work with each other, in the way we work with children, youth, and families, and in the way that we worked with communities. And as a result of that, and let me just tell you, there's a lot more day-to-day work and examining policy and talking to legislators and communities that went into that. But ultimately, we began to have a consciousness about our decisions. We began to have caseworkers who could say to us, I didn't realize it, but when we would get calls from certain parts of the community, we just put the car seat in the car because we already knew it was going to be a removal before we got there. If families lived in a certain part of town, we never believed we would approve a home study for a kinship placement. It skewed our thinking about who was adoptable. It skewed our thinking about which kids could flourish and do well in just a regular foster home. And so ultimately, the focus on what some of the real issues were resulted in an overall reduction in foster care for all children. And it also resulted in a reduction in disproportionality for African American and Native American children. So bottom line, when you raise the bar for those who are least likely to have the outcomes that we desire, we raised the bar for all, and that was our ultimate goal, and we achieved it.
So it really sounds like we're shifting into values and how the values that you set within the Public Child Welfare Agency really led to the commitments that you were able to make. So the value of data and disaggregating it and making sure that you're targeting the right issue at the right time. And I heard you say that you allowed a space for attacking the problem, not the person. So not talking about racist, but really focusing on what is the core issue and how to get at that. And you really valued that and lifted that up. And Patrick, so I want to shift a little bit since we're talking about values and commitment. Could you talk a little bit about, from the foundation standpoint, the value and the commitment that you've made? You know, the death of Freddie Gray really impacted the foundation's perspective and the way we went about business. Can you share a little bit about how you led that effort and focused on what needed to happen next?
Sure. So I want to correct two observations from Barbara's very generous introduction. It was overly generous. The first thing I want to correct is, although I'd love to say that the Casey Foundation is leading the rest of the world of philanthropy, there is a large and very committed group of folks in philanthropy who in many respects have been way ahead of us. In other respects, you know, we're working together. People who have put in, you know, personal investment in very public ways. So that's the first thing. The second thing is actually more important from a personal level. It is very much the staff, the employees, the team within Casey that has led this work since I first got there 20-some years ago. So to leave an impression that somehow I came along and said, let's change our direction, we ought to pay attention to race, would not be, again, very generous, but not at all accurate. The reality is that there has been a constant group of leaders within the foundation at all levels of the foundation who have pushed us both to look at our own internal processes and decisions and how we do business and our culture, et cetera, as well as our grant making and our consulting and our external work. So I just needed to kind of make sure that you know where we come from. The death of Freddie Gray changed how we do our work in our hometown in Baltimore. And in the course of changing how we think about the work we do in Baltimore, also enabled us to look more broadly at the rest of the work. Now, it's not like this examination wasn't already going on. Under Doug Nelson's leadership, it was going on for years, and then I had the opportunity just to follow in that regard. I think that the things that I would lift up, and I'll get to Freddie Gray in just a moment, the things I'd lift up is very much as Joyce mentioned, this collective willingness to challenge the stories that we're told and the images that we carry, the narrative that clicks in when we begin to talk about issues of race, is really the fundamental thing that within an organization like a foundation you really have to do. Because we all come with our own stories, we all come with our own images, they get woven together into an organizational narrative, and if that narrative is off, it's never exactly right, but if it's way off, you can just make all sorts of really kind of boneheaded decisions. So the work of the staff to sort of challenge each other on the narratives has been really important. And part of that, which brings me into Freddie Gray, part of that is the work in-house as well as with our grantees to really look at history in kind of an unblinking, open way. You know, it's one of the great wonders of the world what Nelson Mandela was able to do in South Africa through the Truth and Reconciliation process. He essentially said, we can't move forward until we deal with the past in a very profound kind of a way. And I think that fundamental insight and courage that he demonstrated to the world, if each of us could have a tiny fraction of that, we could make a lot of progress. So that, I think, in terms of our institution, as we think about the problems that we are trying to contribute solutions toward, we really have to think about the history. This didn't just happen. The range of disparities that we see, the rotten outcomes that we see for whole groups of families and children in this country didn't just happen by accident. There were conscious and deliberate policy decisions decade after decade after decade. The evidence is there. It's not a fable. And so really understanding that history and then recognizing that that history is alive today. It's not that this is something that happened and now it's done and now we just have to fix it. We are still finding ourselves needing to examine, all right, let's look at the impact on different populations of this decision. Whether we mean to or not, are we allowing the narrative, the stories we tell ourselves to force us to make really bad policy decisions, practice decisions, et cetera. Which brings me finally to Freddie Gray. You knew I'd get there eventually,
Yes, I
right?
did. I had faith.
So our work in Baltimore also could be a day-long seminar, but historically has been primarily in one section of Baltimore, East Baltimore, where we made a large investment in revitalizing a community. And then we made a series of other grants sort of as a civic partner, including to lots of community-based organizations and to United Way and to large civic groups, et cetera. And that was kind of our Baltimore strategy. With the death of Freddie Gray and in the midst of the unrest, our senior leadership team gathered together and began to reflect, so what do we need to do differently? And we collectively decided that we're about to take on challenges of youth and young adults, what I talked about earlier today. Baltimore, even though it may not have been the place we'd chosen if we were looking for the highest capacity place, it's our hometown, and this is a moment. And so we decided that we're going to start in Baltimore. That's where we're going to work with lots of other partners to try and improve employment and education and skills and the justice system and the whole range of things that impact young people in our own hometown. We recognized very quickly we couldn't do that without talking to young people in Baltimore, and that led, of course, immediately to issues of power, race, the culture of the foundation, how do we have to change, et cetera. So we're in the midst of that conversation as we speak.
And it definitely is a journey.
Yeah, it is, and I was just going to add that the history is so very important. Even the history of the child welfare system. It amazes me sometimes that some of the people who've worked in the system for a very long time are not aware of its history. And the very fact that the group that is most disproportionately represented in the foster care system in every state in the country, that the system did not originally serve that population.
Right.
And so African Americans did not enter the formal foster care system until the late 50s, early 1960s. And by the 1980s, they were disproportionately represented in the system and have been since that time in every state in the country. And so it's important for us to understand even some of the policies that were in place at that time that began to contribute to that. So in isolation of that history, we risk using the same old thinking that created the problem to try to resolve it. And I talk a lot in my work about how important it is for us to really understand how we've been socialized, all of us. The messages that we get that really shape our thinking and our response to certain situations and even to foster youth. And so examining that in a way that says, what are the messages that I have received that cause me to have this often implicit and unconscious bias? And I'd just like to give an example this morning when the speaker said that the woman started running when she saw the dog, even though she had never been bitten by a dog, but she's been socialized to believe that that's dangerous. And in the same way, many of us have been socialized to view certain populations, African American males, for example. We have internalized the message that they're dangerous. And that contributes to unconscious ways in which we might decide on placement options for them. You know, I don't think that it's any accident, if we really think about it, that African American males are usually overrepresented in our higher level treatment centers. The same is true in alternative schools. So it's not just in one system. And it's important for us to understand the relationship that the children, youth, and families that we're involved with have to other systems. And in doing so, it creates a different lens from which we view them. Because every system and institution, if we examine the data, our helping systems, they produce the same disparate outcomes for the same population of people. So understanding that can help contribute to a broader knowledge about the oppressive nature of systems for certain communities and certain populations, and it changes our understanding of what is happening to youth when they come before us. And I keep saying not what's wrong with them, but what happened to them, and what happened to them in their relationships with the systems and institutions that are supposed to be set up to serve them. Yet when you look at the data, we see the disproportionality and disparities that continues to exist. I'd just like to share maybe some of the things that we did to try to change the system's response to foster youth. And one that I'm really proud of is that we were able to secure resources through our Texas legislature, creating positions in state government for former foster youth. And it really was a way to truly bring in the youth voice. And so we hired those positions not only at the state level, but in every region of the state to be the youth voice, to really inform policy and practice. Because again, we could sit in our offices all day long and think that we have the answers, but the best answers come from the people who live those experiences. And we found that in opening the door to truly partner with and engage youth, as well as parents and fathers in particular. We miss a lot of opportunities for permanency for young people when we leave out the community and their families and especially fathers. But we also were able to pass legislation that gives employment preference to former foster youth at state agencies. And so that was a way to try to ensure that as youth aged out of care, that they had some connections to employment, and at the same time that their voice was informing the policy and practice that we were developing to try to support them. And let me just say that there's still a lot of problems in Texas. The issue has not been resolved anywhere that I know of. But I do know that when we are intentional and deliberate about understanding institutional and structural racism, and when we create a safe place for people to raise their concerns, that we began to see more creative thinking and innovative thinking, and it changes the system's response to those issues, and it can result in some really positive outcomes.
So we've been touching on hope, values, commitment. You're starting to talk about some of the promising strategies. I want to take us to obstacles and challenges because I think that we all learn from the struggle. And I know that we're in an evolution process and we're all still learning and moving forward on how to improve outcomes in this area. But I want to spend some time talking about obstacles and challenges. So what were the most challenging obstacles you faced in seeking to ensure your organization's commitment is there to equity and inclusion? And we'll start, Joyce, with you, and then Patrick, we'll go to you.
Well, there continues to be, it was then and still today, there is an unwillingness to have conversations about race and racism. There's a struggle around that discussion. And I understand it from the perspective now that because we don't have a common definition and a common understanding and language with which to have a dialogue about racism, that we often are talking in ways that may offend or, bring up issues of people feeling like you're pointing fingers or laying blame. And that's why it was so important in our work to bring people together, not only in our child welfare system, but with the other systems that also touch the lives of our children, youth, and families, and community, and to have young people in the room to have these tough discussions and to try to get to a place where we could get on the same page with these issues. There was also a struggle in the practice changes that we tried to put in place to ensure that we were doing a much better job of providing for children and youth in foster care. And one example I'll give is that as a leader in child welfare, I felt strongly that babies should not be in shelters and in institutions. But that's a fight with providers sometimes, who make their living with, I've gone into shelters and seen cribs lined up with babies in them, and you see the disproportionality often in that as well. And so some of the thinking that has been internalized has been a challenge, because it's not about people who are deliberately making decisions to hurt. It's not about individual acts of meanness or hatred or bigotry, but it's about how we have for years internalized certain messages that we have not come into a space to examine. And so that has been challenging. Some of my leadership during the time when we brought in workshops like Undoing Racism, we brought those in. Some of them were actually funded by our state legislature. And so we brought those trainings in. We were required to do training as a result of the law that passed. And it was challenging for a lot of people who felt like instead of bringing the group together, that we were destroying relationships. And I'll just have to say that in the work that we do and the level of accountability that we should have to the youth that we serve, we don't have genuine relationships if we can't talk about race and racism. We are not truly accountable if we can't talk about the underlying factors that contribute to the ongoing disparate outcomes that we continue to see. And so that was a big challenge. But one of the things that we decided was that we have to let people be where they are as long as they're on the journey, and not expect that everyone's going to be in the same place. And so in committing to that, we saw some of the folks who were the most resistant in the beginning become some of the passionate champions, as I refer to them later on. It also takes a level of risk. It requires a level of risk-taking. This is not easy work. And at one point in my career, I felt like, would I always have to be the one person to stand up and make the obvious comment that everybody else should see, but it seemed no one else could see it?
It sounds like there's maybe a lot of one-person people out there who have to stand up and talk.
And I'm sure some of you in the room have felt the same way, but and I know we're talking about challenges, but those challenges can be overcome. I saw us get to a place where even some of our judges were the ones who were standing up saying, but shouldn't we be looking at this or that for our young people? And so we developed a whole collaborative effort that included multiple systems of people who then, when we got into a room, we could have a conversation because we had done the work that allowed us to all know what we were talking about when we used the words institutional and structural racism. And so we no longer felt like we needed to be defensive or that someone was calling us a racist, because we were kind of on the same page. And the one thing that is kind of the catalyst for keeping us in the conversation, is that regardless to how we think it needs to happen, we all want the same end result. And so if we put that in the center of our conversation, then we can overcome the obstacles and the challenges.
And I just appreciate that you're saying that, because I think that talking about race, equity, and inclusion, and when we open it up to the audience, I fully expect a question around, why is everything about race? And maybe someone won't be brave enough to ask that question, but that is another conversation that's going on that I'm sure we'll get to. But Patrick,
Can I just say one thing about that? Why is I've been asked that. Why is everything about race? And one of the things that it is clear to me is that we can talk about all of the other isms, but when you add race to any ism, there's a much more profound impact. And when we made things equal in our examination of our work in Texas, just one quick example, we would attribute inequities to poverty or to single-parent households. And when we did the analysis at the caseload level, and we would look at cases where both families were poor and both families were single-headed households, and they had come to our attention for similar allegations of abuse and neglect, guess what? Race predicted whose children would be removed by all caseworkers of all races. And so to examine it at that level required that we be accountable for understanding it and digging deeper and figuring out why we did that.
so there's the answer for whoever. I really appreciate that, because that is even within our own teams, we've been having these conversations around race, and we have debates about it. And you do have to have a safe place. And I want to shift to you, Patrick, about some of the, I've been doing having those conversations within the foundation. And I know that foundation-wide, we've been having a lot of conversations. So could you talk a little bit about the entrenched challenges that we're facing and how we're working through them?
Sure, and it's hard not to be overly glib and superficial about such a profound question. I'll try to avoid it, but it's almost unavoidable in a context like this. Just at the simple human basic level, I think it's difficult to get to a level of honesty about a conversation about race. Part of it is our own imperfections, our own clumsy language, half-formed thoughts, people feeling overwhelmed by their emotional response. Part of it is that we frankly use the same words to mean greatly different things. And those words are emotionally charged, and they're laden with meaning, but it's different meaning for different people. And so that's where the courage to continue talking, to get past the first sense of, you just called me a racist, or you just insulted me in this way. And we're using language in the clumsy way that humans use language that actually doesn't end up bringing us together into a common place. Now, I'm not, by the way, saying that we have to get to the place where everything is comfortable, because it shouldn't be comfortable. But I am saying that sometimes I think we find ourselves, and I know I've been, I contributed to this too many times in my career, we find ourselves unable to get to a real, genuine human conversation because our language is so clumsy, or our assumptions are so broad that we don't get that human connection. The other challenge that comes to mind, Joyce already touched on, but this notion of implicit bias, that is that, it's not so much that people are sitting around saying, well, let me figure out how I can be racist today, but rather, again, the power of the stories we tell ourselves, the images that we have, the kind of other part of our brain that reacts and clicks in, gets in the way, again, of having not only honest conversations, but making good, good choices. I think, again, if we're just at the level of how do we talk about race, many of us, certainly many of us at my advanced age, we've had lots and lots and lots of frustrating and what have felt to be unsuccessful conversations who at their best end up with, we talked about race. Didn't do anything about it, but we talked about it. And so there's a certain fatigue of, are we actually going to do something on the one hand, or are we going to be talking past each other, et cetera? That's why I think this is such an important moment, and why I think the work that you collectively are taking up is so critical, because it's an opportunity to not only have the honest conversation, but to move to actually taking action. And the last sort of piece that I'll throw up here, somebody earlier today made a short reference to privilege, and that's a whole seminar right there. But one of the challenges in dealing with race is that there are many of us who have benefited from the history. We have benefited, whether you're talking about financially, in terms of power, in terms of influence, in terms of where we live, in terms of the life our children have, in terms of the opportunities we have. We have benefited directly because, and in proportion, and sometimes out of proportion, to how others have suffered and how others have been disadvantaged. And that doesn't mean that I personally sat down and figured out how to do that, but if we're going to really deal with issues of race, we actually have to address the resultant disparities, again, that are not accidental. And to do that means really confronting the privilege that those of us who did not have that history or did not experience the history, weren't victimized by the history, the advantages and the privilege that we enjoy. That's a tough nut, right? That's really getting down to, so if you're really serious about doing something about race, what are you going to do about your own privilege is a much more complicated, difficult conversation than, oh, I'm going to take a holy picture, I'm against racism, right? I mean, that's easy, right? But to really take it up is much harder. So.
The other thing is to really recognize how the messages that we get from everywhere, including from our history, sends us messages that we internalize. And that for some people, the messages that they get give them a sense of superiority. And for others, the messages give them a sense of inferiority. And how we internalize that and then act it out, often unconscious. And it is my explanation for why workers of all races make decisions that create disproportionality and disparity. It's because the message that I have internalized about me, I internalize about people who look like me. And so that is the work that I had to do and that we all have to do to really examine and question and get in touch with those things that we have been socialized to believe at a very, very early age. One of my staff, who was a regional director, a white woman, who was my biggest challenge in the beginning and then became one of the most passionate champions in this work. When she retired from her regional director position, she decided that she wanted to work as a program specialist in our Department of Disproportionality. And she said, I have to stay connected to this work. She said, because as a white woman, it would be easy for me to just pick up my purse and walk away and never have to think about this again. And my response to her was, as a woman of color, I wish every day that I could just pick up my purse and walk away from it and not have to have daily reminders about who I am in this country and in this work. And so get into a place where you can have that kind of cross-racial dialogue is the opening that space for the beginning of the real work that we all have to be willing to do, and recognizing that it's not easy. The conversations won't be easy. There has to be a deliberate effort in those dialogues for us to hear each other's truths. Because if I never tell you my truth, and it's not your experience, then how will you ever know? I have been in workshops where people have said, oh my God, I didn't know you had to deal with that. And they didn't. And so it's really about coming together and putting in the center of that space the overall vision that we all want. And we know that that's the same. But how we get there and our understanding about the why of it is going to require that we do some work, that we let go of some of the things we have believed to be true for a long time, that we be willing to let some new information in, and that we're willing to really kind of get our boxes closer together in our thinking about why, in spite of all of the things that we've done, we still have not achieved our vision for why we came to this work in the first place.
Joyce, there are quite a few child welfare directors in the room, and there are some department staff who are here as part of working with older youth. And I came from that world, and I would sit in the room and think, okay, we're talking about it, and this is great. What do I need to do about it? I think if from your experience and what you did in Texas, you've talked a lot about having conversation and creating a safe space for that. And knowing what you faced in the public child welfare system, what are some tangible strategies that you could offer, not just the child welfare folks who are working in the public system, but for all of us here, that if they could just start today, what might that be?
Well, I would say examine your data. And not just know that it tells you that there's disproportionality, but start a conversation about why. You know, why do people think that the data says what it says? If the conversation is not easy to have, because you're going to have to talk about race, then bring somebody in to help you start the conversation. I did. I didn't lead the conversation all the time myself. I brought some other folks in to help me with the conversation, and eventually I could lead the conversation. And when I was able to lead it, there was not ever a leadership meeting agenda that didn't have something about this on it. And not just to talk surface level, but what are the stories that we can tell that truly demonstrate that we understand the values that we have put in place, that we are going to really look at examining and addressing disproportionality. What are the real life examples that speak to that? And so, and I started with my leadership team at the state office level. We were the first to begin to question and examine. And let me just say that Casey Family Programs was a big supporter of our work. And so they also came in and helped support us bringing in the Undoing Racism workshops and then engaging the voices of youth and families. And not even having leadership meetings without those persons in the room with us. Expanding that work to trying to look at data for our other systems, and then working in partnership with our judiciary, our juvenile and family court judges. You know, I had a judge tell me once that after going through an Undoing Racism workshop, and we did 3 years worth of implicit bias conferences for judges, but the judge to say he had been on the bench for 25 years. He said, and you know, every day my courtroom was filled with black and brown people. He said, and it never occurred to me that, he said, I never even thought that there was anything to be, I was not even conscious of it until after I had gone through this experience. He said, and then it hit me, there's something wrong with this. But he had been socialized to believe that those were the folks that should be in his courtroom. And so his response was that he was going to start asking some different questions. Like, why is it that in my drug court, where families are referred for services and supports, that there is not the same disproportionate number of black and brown people in that part of my court. And so you have to keep this topic and the subject and the conversation in the forefront, because one training is not going to change anything. People get excited, and well-meaning people say, oh yes, I get it, what do I do next? But this is hard work. And so generally what we'll do is go out and revert back to the old way of thinking, because that's easy and it's comfortable. And so I think that it is the responsibility of the leader and the leadership team that they develop to make sure that you have the space and that the topic and the discussion is ongoing, and you're using the data to examine whether or not it's making an impact.
And it also sounds like it really, we often put a lot of the burden on the child welfare agency, but we do operate in a child welfare system. And I know that there are some judges here and other court folks that are a part of that process. So it really does mean the whole system, not just the agency carrying that torch by themselves.
Right, providers,
Right.
CASA volunteers.
Everybody.
Everybody was engaged in that work. So it was a cross-systems collaborative effort.
I'm going to give you all a chance to think about some questions you might have. I'm going to go to Patrick and ask him about some of the strategies that the foundation has seen that are promising strategies that are chipping away at this issue and helping improve outcomes and reduce racial disparities. So be thinking about what questions you might have, because I'll go back to you in just a minute.
Sure. So I'm reflecting both on what we've tried to do within the organization and what we've tried to do in support of others. I guess I'd want to start with the notion of a common frame. Within the organization, we are in the midst of ensuring that every person who works for us, and again doing it within teams, have an opportunity to learn about race, equity, and inclusion, and improve their own competence to both understand, to be able to talk about, and to be able to intervene and work towards improving the disparities that we see in outcomes. That, I think, is bearing fruit, because we have a common way of talking about issues. Now, we spent a good year working with lots of outside experts who came in and advised us on what a useful common frame was that wouldn't simply be surface and glib and just sort of make you feel better or make you feel worse, but actually would lead to change. Part of that that has been, I think, a hallmark of how we've tried to do all our work, again, is starting with data, and I would broaden it to starting with evidence. So we had always disaggregated data by race, but about a year and a half ago, we came out with a publication called Race for Results, where we actually figured out a scale that would enable one to compare different groups on their, essentially like an opportunity index, from 0 to 1,000, right? So if you had all the opportunity in the world and everything was on course, you'd get 1,000, and if you had none, it'd be 0. And we were able, by using that scale, we were able to sort of compare states in how they were doing on the discrepancies, the distance between those who were most advantaged and those who were least advantaged. And while Kids Count has been a annual publication for the last 25 years, this particular version of Kids Count enabled us to look at some states that on the usual Kids Count index showed up very, very high, did very, very well. But on this question of how African American children or Native American children or Hispanic children were doing, actually showed that they were towards the bottom of the list. I use that as an example because it introduced, and one example is in Madison, Wisconsin, where they had done some of this work, and now they're moving forward with a whole agenda that was driven by the data. Related to that is Casey tends to, lots of us tend to look at aggregate data or big data numbers. We're now moving more and more to think about how do you track life course? How do you look at circumstances of birth and early childhood experiences and early elementary school all the way through the life course, by figuring out how to integrate data and be able to track children, not as individual children, but thereby being able to say, this is the life course of a child born in East Baltimore. This is what we see over time, and thereby, again, being able to ask better questions and have better answers to how we intervene. That's another level of evidence. I talked before about the evidence of history. Too often we look at these data in an ahistorical perspective and therefore draw conclusions that are flat out wrong because they don't take into account the history that led to that particular outcome. Related to that, more qualitative data, that is more bringing in the voice of and listening to not just a few folks who've lived the experience, but lots and lots of folks who've lived the experience, and using that qualitative data to kind of tell the story behind the numbers so you actually have a better sense of what the true narrative is. I mean, all of these, I think, are ways to understand the evidence that start to open up. So maybe there are, for example, this is a big debate in the field, but I'm one of those who believes that a big driver of lots and lots of lousy outcomes is residential segregation, and that it historically has driven lots of lousy outcomes. There are ways to deal with residential segregation that we need to take as a country. If you don't understand residential segregation as a driver to lots of bad outcomes, then you're going to go the other route. You're going to say, well, you know, it's the demise of the African-American family that is causing all of these lousy outcomes. And believe me, I'm not saying that there's nothing to do with family that has to do with how kids are doing, but the forces on family driven by residential segregation starts to tell a much broader kind of a story. So I think I'll stop there. Those are some of the things that I think about.
I was just going to add too, when you look at residential segregation, because in my work I like to look at and recognize the fact that disproportionality and disparities can be tracked to the community level. And so in most places where we live, if people can point to certain communities and zip codes and say that those are the places where people live who, and we usually attribute it to the individual, that there's something about them. But if you look at the data for systems and institutions for those same communities, you will see the oppressive relationship that those systems and institutions have with those same communities. And so when we look at schools, for example, in some of those communities, and we look at how we generally think about individuals being accountable. So recently, I work with schools, and recently we made the observation that we have standardized tests, but we don't have standardized schools.
That's a good point.
So the same outcomes that we see being predictable by race in child welfare and outcomes for foster youth, we see the same thing in our education systems. And so that's another critical area where we know being a foster youth in the education system carries its own set of issues that need a lot of advocacy on the part of those of us who work in that area. But then again, when you add race to that, you see the disproportionality in discipline and in school suspensions and special ed and all of those other areas. But a lot of it has to do with the lack of adequate resources. And we're not saying that individuals shouldn't be accountable. I'm not at all saying that. But I am saying that for too long we've been having a one-sided conversation about what needs to be fixed. And most of our efforts have been targeted toward fixing what I call, quote, broken people. And I believe that the time has come for us to become critical lovers of our systems and institutions and be willing to love the work that we have chosen to do so much that we're willing to consider that maybe what's broken is the systems and institutions, that those are the things that are broken, that we really need to be focusing on fixing structural and institutional racism that's embedded in our policies and our practice.
So we're going to, as we think about our commitment, renewing our commitment to race, equity, and inclusion as part of the Jim Casey Youth Opportunities Initiative. We have 2 leaders who are willing to answer any question that you might want to ask, except for Joe, maybe. Who has a question? Adrian, you want to start?
Yes. I just wanted to ask if either one of you are familiar with the Struggle Olympics, and do you believe that something like the Struggle Olympics is a hindrance to the progression?
Can you explain Struggle Olympics for those of us who don't know about it?
Okay. Are y'all familiar with Struggle Olympics? Oh, really? Okay. Well, I just no. But the Struggle Olympics is basically when everyone overlooks everyone else's problem because they have their own problems. It's like winning a competition to see who has the most struggles. Like, well, I'm from here and I went through this, or, so why should that problem be more significant than my problem? You know what I mean?
So if I can paraphrase maybe a little bit, it's sometimes when people of different classes or races or ethnicities might say, well, we had it worse because we were enslaved, or we had it worse because, is that what you mean?
Right, and overlooking someone else's problem because you've had your own problems, or, say, well, I'm Irish, and when we first moved here, we had to go through this, or I'm Italian, and we had to go through this, or anything, or my gender, or I'm a woman, so I had to go through this, and people use that as a blindfold to other people's struggles.
So you're making the exact point that I think Patrick made earlier about having common definitions around Struggle Olympics, because I think when you first said that, I thought, oh, well, what is that? And I had a totally different idea in my mind. But I think so the question that you're asking really is around how, what is their perspective on basically a competition of who had it worse, and just sort of not minimizing, but overlooking, since I went through the struggle.
Right.
So what?
Some people would say, I had it rough too. Why should I feel sorry for you?
There you go.
My response to that is always that if we continue to allow racism to manifest itself in us and in our systems and institutions, that we all suffer from it. And so there's something that racism does to all of us. If we look at racism and think that it's just about what it does to one group, then it puts us in separate places. Well, I'm not a racist, and I didn't have anything to do with what happened to you, so why should I be concerned? But when we really understand the way in which it robs us of our humanity. When we understand it in that way, then we don't see it as your problem or my problem. We see it as a problem that's affecting all of us. Your question is, and I've had some of the things that you talked about. Well, why is it that we're only talking about what happens to African Americans? Or, for example, in Texas, to Native Americans as well, who were disproportionately represented in the foster care system. And I just have to tell you that I kind of used the data in defense to say, our strategies are data-driven. There are some folks who have suffered. They have a different history in this country. We're focusing on what happened here. And if you track people's experience in this country, you will see that many people came here not as whites, but then they were able to become white. And that's part of the history, that once we know it, we see that not every group has had that privilege.
That's a really good answer. I'm going to archive that in my mind. Okay, other questions out there?
I have a statement more than a question, but I'll turn it into a question. I just wanted to say how much I really appreciate, I was sitting here today, and I really appreciate, we had this theme of well-being, and I really appreciate that you guys bookended it by sort of centralizing that around this race and equity and inclusion debate. I think that was just such an important thing. I think, as Patrick hit on, you could have easily not done that and made it a separate piece. And so I just want to thank you for that boldness do that and for us. But I'll turn that into a question of saying, could you both maybe just speak a little bit about how, well-being and race and equity are sort of inseparable in this, but just talk about that a little bit maybe.
Well, we always start with the evidence. And if you look at the evidence, the definition of well-being that we've used at the Casey Foundation is captured in that Race for Results publication that I talked about, which we will periodically update, of course. And it's so clear in the data that there are huge disparities in well-being that are directly connected to race and ethnicity. And as I said before, if you just look at that, look at the numbers and walk away, you're left to draw conclusions largely based on the narratives and the stories and the images that we've heard and told ourselves over many, many years. But if you put it in the context, again, of history and current dynamics and both major sort of economic forces and demographic forces, but at the end of the day, mostly policy choices that we've made over the decades, the disparities that we see, I believe, are largely the result of those choices, which means there's opportunity to make different choices. There's opportunity for us to make different choices about how we open up opportunities more fully. And that's based on, as someone said earlier, equitable treatment that takes into account the full range of challenges that someone has and provides a path forward that takes that into account, as opposed to everybody gets treated exactly the same as if everybody were exactly the same. It's much more complicated, much more difficult, but it's the only way out of this as far as I could see.
That just gives me a window to use my tagline and say that equal treatment does not lead to equity. And so it's really important for us to use the data, as Patrick has said, to really understand that there's something that's going on within the way in which we respond to often the same situation that creates a disparate outcome that is predictable by race. And so as long as that is in place, then it will disproportionately impact the well-being of some populations. And we know, for example, that youth of color will enter, stay longer, less likely to graduate, less likely to have those permanent connections. And so there's been some research and debate recently about whether or not African American families abuse and neglect their children at a greater rate, or whether or not it's because of poverty. But the question is, even if that were so, what happens once they're in the system? Mm-hmm. Then where do we point the finger and lay the blame? And so I can't be healthy and well if my race predicts my success and my outcomes in a system. And so that's the importance of doing equity work. I was sharing at a table earlier this morning that little caption that had people of different heights trying to look over a fence. And the equal response is to give them all the same size step to stand on. But some of them still can't see over the fence. And so we have to be really take into account not only race, but other unique needs around culture and history that will then allow us to have that racial equity lens to kind of have the response be one that's going to yield equity in the long run.
Other questions?
Well, so I want to just make a comment about, I do have an understanding of that we have been conditioned to feel a type of way about a specific group of people. And I'm a mass media major, so I see that that is one of the major vices that has been manipulating people for a long time is the media. I hear a lot of people talking about the issues with racism, but what are solutions? I think that's where a lot of us kind of know some of the issues, but like there aren't many options for solutions. I would like to hear some of your ideas of what you think stuff that we could do in the community to kind of break down some of those barriers and, you know, kind of variety options.
Sure. I'm going to solve it first, and then you can. You know, it's exactly the right question, and I don't have some grand plan that's going to necessarily take care of everything, but I think that for me, identifying those systemic challenges that are changeable, that we can move on now, is the place to start. And I promise myself every time I'm in any kind of audience and have a microphone, I'm going to say this. So here's my chance. I've been waiting for it, so thank you. For me, one of the most egregious examples of how race plays out in a way that harms people is our current approach to delinquency, where we routinely take young people who have committed acts, some of which are very similar to what almost nobody in this room, but almost everybody experiences as part of adolescence. Some are more extreme than that, admittedly, but many of them, in fact, my own children, my wife, lots of folks I know, everybody except me, has done things, you know, at least as bad, if not worse, and gotten away with it, if you will, gotten forgiven, gotten some other approach. Our current approach to juvenile justice, especially for African American, Latino, and Native American children, is to lock them up in essentially youth prisons. And I believe it's time to close those youth prisons, to close them down. And you know, that is driven in part by a sense that if, and I know this because I've had the experience, if it were one of my own children who was facing that prospect, I would do everything I could to make sure that my child wouldn't spend even a single day in one of those awful places. And if that's the case, those of us who say that we care about race and care about change and care about really bringing this work to do something different, for me, that's a great place to start. If you really feel that way, then get behind closing the youth prisons. Now, there's lots of other issues one could choose, but I think that's how we attack it. We attack it at the root, which is at the system and the structural level. In this instance, the juvenile justice system, and that's the structure we use to respond differently when it's an African-American 17-year-old who gets into trouble than when it's a white 17-year-old who gets into trouble.
And I would just follow up by saying that when I'm doing workshops, it doesn't matter what profession I'm with in the helping field. I show data across systems just to really demonstrate that racial inequities look the same in every system. And the data is often really alarming, but people don't seem to be shocked or even surprised by the data. It's like we have become numb to that information, and we've come to believe that that's just the way it is for those people. And so when I say, aren't you shocked about the HIV prevalence rate for African American teenagers? It's like we have got this sense of, so we need to get energized, almost, you know, we need to have some anger about the data. And so one of the things that I've been asking in sessions that I do is, when I put all the data up and I ask, what if it were reversed? What if the outcomes that exist for African Americans who are at the bottom in every system, what if that were white youth? And folks say, well, heads would roll, and some people would lose their jobs, and you'd see some things start to change because that would be unacceptable. Well, then we need to have that same kind of response. We need to have that same kind of response. And I know that's not really concrete information, but what you have started to do here today is the beginning of doing something. Because first we have to become consciously aware, and we have to begin to examine that numbness and those reasons that we have held to be true about why the outcomes exist. Repeatedly, people tell me about if their parents cared more and did this or that, then these kids wouldn't end up in trouble, or they wouldn't be failing in school. And that's when I use my line about not having standardized schools and things like that. But we have to kind of generate some energy and some deeper questions about the why of these issues, and engage in dialogue and examine deep enough, because we can't go out and do anything with the same mindset that we currently have. Not much, anyway. If we still think the reasons why the outcomes are is because it's about what's wrong with the people. And I really appreciate your comment about the media, because we get lots of our messages from there. And so just understanding how the media influences what we think. And one thing, so I was told recently that we wouldn't have another black president soon because of President Obama's failed policies, and this is not political at all. But it's to demonstrate how we have a tendency to, I say, collectivize certain groups. So that if one person is that way, then they're all like that. And so to examine that kind of thinking, and my response was, how many bad white presidents have we had? And did you ever hear anybody say we would never have another white president? Now that's to make a point. That's to make a point, to make us think. To make us think how that then drives our response to certain populations who we have grouped together in certain categories based on a few examples. And so we have to start thinking differently about what the data is saying to us and examining that through a different lens.
And I would just add that that's what you have team time for, and we'll have team time later on today so that you can each take a look at your individual data and strategies that you might want to move forward with as part of your team, because you are all in different places. Some of you have been working on this for a really long time and have made a lot of progress, and others have focused on different strategies. So that's why we have team time, is so that you can look at your data, figure out, digest everything that you're receiving today, and figure out what your next steps are. Chart your course to the result that you want to see, that we all want to see. So one more question, and then we're going to wrap up.
I just wanted to answer Antoinette's question. So through my academics, throughout one of my classes, we would practice something called suspending. But anyway, I really like to learn about like humanistic psychology approaches and stuff. And one thing that like anyone on this road can do is whenever we greet or meet people, we really want to treat them as they're immeasurable. And it really is a practice, and I believe it is like a lifelong practice. And sometimes, like, and you know how we're talking about, like, we have implicit thoughts about certain things, and it's not always our fault. And sometimes we're not aware of it, sometimes we are. But the thing about suspending is, like, you know, sometimes we meet like some people and we have like maybe a bad thought that, you know, we might not want to have, but it just happens. And like it happened, but you can like let it go. So I think anyway, the main thought is you know, we really want to treat every person we see on this planet as immeasurable, basically.
Thank you.
Yeah.
I would also say find ways to interrupt interrupt racism. Sometimes we see it and we're silent. So find ways to interrupt it. You know, don't condone it by silence. You know, if something offends you in a respectful way, say that. Because that person may not even know that they've said something that's been offensive. So start being a little bit more courageous in interrupting racism.
Awesome. Please join me in thanking our amazing panelists today.